The only one that cares about you is you and your dad, your mom, your family. And I see this in the professional athletic world too. They push you for surgeries. They push to do whatever it takes to get you back on that field.
I came back from Baltimore and I just told them I got stem cell injection on my foot, and they were pretty sour about it. They didn't like it because I didn't do their treatment, didn't do their surgery, didn't go through them. I can say for a fact that that meeting that I had with them when they reviewed the x-ray and found out that I was healing right and fast, they had a change of tone big time, and they went from extremely skeptical to interested in what I did and how it works.
Hello, everybody. This is Dr. Mark, the Stem Cell Doc. We are here for another podcast with a few very special people of mine who I've become quite fond of, actually. And they're in other parts of the country and in other parts of the world. It's been a privilege and honor to meet both of them. And I just feel that everyone should actually hear their story, which has been quite remarkable. So I'm going to bring on the show now Andreas Anderson and Hakan Anderson. How are you guys doing?
Doing good. Excited to be here with you.
Doing really good.
So,
good to see you again.
You too, my friend. And you're over in Sweden. We've had you on the show before, and that's where our journey started, with you, helping you, and then you bringing your son into the picture to see if we can help him. And it's been quite awesome. So how are you guys doing out there in Sweden, Hakan?
Pretty good, doing really good. I was thinking the first time I got in contact with you, and it was like in 23. So it's been a while now.
It's been a while.
Yeah.
And you've been here a couple of times, but I have yet to come visit you.
Yes.
So we're going to have to make that happen.
We're going to have to make that happen, yeah.
So tell me how all this started, Hakan, with, we all know your journey and it's been great, and we're so happy for you, but what happened with your son, that you felt the need to share this with him?
I got in contact with you, Dr. Mark, in 2023, and I wanted to, go meet you and get treated, but I didn't have anything to kick me off. So in the early spring of 24, my son got injured playing rugby, and he injured his shoulder. And I said, this we're gonna have to go and get stem cells for your shoulder, and that was the thing that triggered the whole start of it.
So this is all about you, Andres.
Yes.
I guess
Daddy loves his son, man. He loves his boy. So tell us a little about you, man. You're out in Arizona, Tucson, where it's probably starting to get hot out there.
Oh yeah.
And, what are you doing out there, man? Well, what brought you out there?
Well, my mom is a Tucson local, Tucson native, and I've lived here in Tucson like on and off for like a large part of my life. So basically I ended up here again because I was over in Ireland playing rugby, and I wanted to like further pursue my rugby career. And I found out that the University of Arizona here in town has a good rugby program, so it ended up being perfect because my mom is in town and I get to play good rugby, and if I can put the heat aside, it's a pretty good place to live.
That's right. Well, I need to know something because I was a football player. So let me ask you something. How do you rugby guys look at us football players? Because we wear all those pads and everything.
Well, there's definitely a high level of respect because, well, obviously it's a rough sport as well. But the pad thing is something that we don't like,
Well, thank you for saying it like that. But I know the inner mind of a rugby player. My son played rugby too. So, so now you're out in Arizona. You're playing rugby. What's been going on?
Well, obviously, like stepping up from like high school level rugby to college level, everything kind of gets faster and harder. So I started to pick up some injuries, like from my freshman year here. The first semester, I injured my right AC joint, my shoulder. So it was something that not a severe injury, but certainly something that can hinder you if you're trying to like continuously play. So I did traditional PT for about a year and a half, something like that, and it would get better slightly to where it wouldn't hurt and I could kind of hit people, and then all of a sudden something would go wrong and it would hurt again, and I'd be back kind of in square one. So this just kind of repeated, like slight healing and then back to square one and slight healing and then back to square one. It was getting repetitive because it wasn't actually getting better.
Gotcha. And the type of sports you're involved with, we all know athletes play injured. That's not always the answer. We've got to fix this way. If you do have a career in this, if it doesn't get fixed properly, it could hinder your career, your life.
Absolutely, yeah.
So what happened when your dad called you about coming to see me? Did you think he was crazy? Like, Dad, what are you talking about?
I mean, in a way, almost, because at that time I hadn't really looked into like I don't know if you would call it alternative treatments,
Sure.
because it wasn't like a streamlined typical treatment. Like if I went to the doctor about it, he'd want to put a cortisone shot in it. He'd want to do surgery. He'd want to do all these things that like they typically do in the US medical system. So him telling me like there's this uh possibility to do stem cells and it might just heal up your shoulder like it was brand new. Certainly suspicious the first time. But I had faith because he was a true believer in it, and I checked out your uh Instagram and your case studies with other clients and stuff, and it was kind of then that I was like, all right, it's definitely worth a shot.
hmm It's almost like you start seeing all those videos and you're like, holy cow, is this
Yeah,
true?
it might
Why
just
are
work.
all these
Yeah,
people, getting this stuff? And it is true. I mean, we've been very, very blessed to see people from all over the world, professional athletes, actors, actresses, A-listers, um, regular people, and then guys like you that are just coming up that, your future's ahead of you. The last thing you need is an injury to stop you in your tracks.
yeah.
And so let's fast forward. You guys came to see me. What happened from there?
Well, when I asked my son, it didn't take him very long to say, well, I'm prepared to try this.
hmm
It was I don't know how long it took you, Andreas, but you didn't think very long at all. I said, let's go for this.
Yeah, I was desperate for something that was going to actually work because, like, specifically those last, year and a half, it was something that was repeatedly bothering me and hindering me from playing to my like full ability. Like you said, Mark, like you can play through injuries, but it's certainly not optimal.
Correct. Um,
Yeah.
and I'm so glad you took your dad's advice because often we don't like to take our parents' advice, because at a certain age we know everything, right? But
Absolutely.
but no, it's awesome that you came, and I'm glad you came to my headquarters here in
Yeah.
Maryland.
Yeah.
Um, we have such a great team of docs here. So you came here, we took care of you. You went back out. Tell me about what happened afterwards.
So the season had kind of passed, and I was pretty upset because I had worked my way into like a chance of like starting for the team, but the right then is when I re-injured my shoulder, and it was my mouth was sour at that point. I was fed up with it. So we go there in May after the season's over, and I get the injection at two different positions, and let's say within a month it had healed up better than it ever had before that, naturally, or with PT training and the kind of traditional methods.
Were you amazed?
I was amazed.
Everybody's probably looking at you and go, all right, what did you do that gets you back 100% now?
Yes. Like it was to the point that like people on my team and stuff, when the season started back up again in fall, like they think it's witchcraft. They think you did a little hocus pocus and suddenly my shoulder healed up. But
Hey, whatever they think is fine as long as you're back in the game,
Yeah.
playing at the highest level that you can. At any time, was the treatment uncomfortable? How explain, you went through the treatment where did it hurt?
I've never been a lover of needles. That is my weakness, but it really is painless. it's just like I said, you can do the one injection, but you explained to me that that if you can kind of do it from a couple different positions, and you have a better chance of spreading out those stem cells so they can like really effectively target the area. So
Yeah.
the first time was certainly a little scary just because of my fear of needles, but it was absolutely worth the results.
Awesome. Yeah, no, it was great. And you're not alone. I mean, I treat some of the biggest guys in the world, and I mean big guys. And those are the guys that are the biggest babies. So don't feel bad. You did great. So you went back, you played, everything was great, and then I got a phone call that something very, very bad happened. So explain to everyone what this next injury was.
Yeah, so that was great. My shoulder was strong, and I was able to kind of get back in the gym doing like exercises that I couldn't do before. And then let's see, February 18th of this year, I was having practice. It was just before the rugby season was going to start. And we're doing contact training, and one of the freshmen hits me and kind of rolls off the side, and he, with his ass and full weight, just drops directly down on my foot. And I didn't know what it was at first, but I came to find that it was called a Lisfranc ligament injury, and it was a severe one. So the ligament was torn pretty much all the way through. Based on my understanding, it was hanging on by literally a thread.
Yeah.
And along with that came with some fractures to the bone on either side on the metatarsals of my foot.
Yep. Great description. And again, after examining you and seeing the X-rays, the MRI, the reports, you did it pretty good. All the ligaments were damaged. The bone was damaged. What did the doctors, the orthopedics, say to you back in Arizona?
So they were the first people that I kind of came in contact with after the injury. And they immediately advised that I go get an X-ray. So I go to like a X-ray clinic, and I do the X-ray, and they get it back, and they tell me I'm absolutely good. There's no structural damage. And that kind of made me feel hopeful, because I was like, all right, this is just like a little stinger. I'll be up and running here within a couple weeks again. But then the pain and all that kind of stuff, it persisted. It didn't go away. It didn't heal up like I thought it would. So it came to the point of needing an MRI to get a better look at the ligaments and tendons and muscles and stuff in my foot. And that was really when the truth came out that I had done significant damage to my foot.
And what was their recommendation at that point?
So, well, actually, before the orthopedic doctor, before he even saw the MRI, he was doing some tests on my foot, and he just told me I needed surgery to ever like play rugby again.
A career-ending injury.
Yes, if I didn't do surgery, they said it's you're never gonna kind of be able to play rugby again to the level that you want to, and it's gonna be re-injured, and you need to do surgery.
And that's had to break your heart to hear that no that advice and their instruction, and plus your dad too. I mean, you're his
Yeah,
son. We don't want you guys hurt by any means. And here you get this devastating news that, your sport life is over, and this will probably plague you for the rest of your life. And just the worst news ever.
it was.
Hakan, you were pretty upset, I'm sure, when you heard that.
Yes, that was those were not good days, and I right away though I could notice that Andreas had resistance uh about doing surgery. He had that from the beginning. We had planned to meet in New York City because he was going to play a game there, but he ended up coming there with a knee scooter,
Mm,
in a cast. That was not fun, but we
sure.
stayed there a couple of days, and we started talking, and then we said, I said to him that why don't we contact Dr. Mark, see what he says. We contacted you, and you said, I've never treated anything like this. I don't know if it's gonna work, but give me a day and I'll get back to you. Yeah.
Yeah, I wanted to do a little research myself more into this. I knew about the injury. I wanted to see the reports and the actual films just to see how severe it was. And when I did see how severe it was, we have to be honest sometimes.
Yeah, yeah,
We don't know if this is going to do the trick. So I was willing to try. You guys are willing to try. And listen,
yeah,
we had time on our hands. No one wants to rush into surgery. If this doesn't work, you still can do surgery to repair it. But if
yeah,
it does work, which I will tell you, I've seen miracles happen unbelievably. And
yeah,
if this does work, we just saved you from something that, surgeries are not always successful. You guys know that, you know,
yeah,
and if we could save you from getting cut open and getting hardware put in there, that changes the whole dynamics of your foot. So I was ready to dive in because in my heart and mind, you guys know me, I'm a very faithful Christian guy. I really felt that this is going to be the thing that saved you from going under the knife, and so of course I encourage you to come, and then you guys came down here, and go ahead, explain from there, Andreas.
So we kind of figured out that we were gonna go for the treatment the like last 2 days or something of us being in New York. So my dad was gonna head back off to Sweden and I was gonna head down to Arizona. So it kind of posed a bit of a logistical nightmare with flights and getting from New York to Baltimore for the treatment. But luckily enough, we figured it out. And like I said, even I can say even more so for my shoulder, I was skeptical just because of the information that had been fed into my ears repeatedly from my doctors, my coach, the PTs associated with the team. All of these people were just telling me, just do the surgery, get it over with, so we can start healing and you can play rugby next season again. And they were very much emphasizing that it was a really bad injury that wasn't just going to heal up.
Mhm.
So with that degree of injury, I was like, okay, this is going to be a real tester of Dr. Mark's treatments. But I had faith as well because it absolutely worked for my shoulder. It works for my dad. You can go on your Instagram and see all the different people that your treatments work for. So there was that hope there, but
Mhm.
nonetheless, skepticism just because of the severity.
Yeah, that is a severe injury that you have, and when we performed the treatment and you were in there, and I saw how swollen certain areas of your foot were, and we just decided to just do as much as we can all around your foot to try to cover every area that we could to give you the best chance of recovery. And then it was just really about time, just going back and letting this thing work its magic on its own. I will tell you from the past, when I was a young man, I played football, obviously, and I sustained a very serious knee injury that required reconstructive surgery. And it took me out of playing that season, like you. Of course, headstrong, nothing. I was indestructible, like you are. And, so I did the surgery. The next year I came back and it happened again. And I had the coaches and everybody really breathing down my neck about surgery, surgery, surgery. When really what it was all about, now that I'm older and I understand the game, people are not going to like me for this, but you know, the only one that cares about you is you and your dad, your mom, your family. These guys need bodies on the field that can produce. And I see this in the professional athletic world too. These guys are, they're paid players. And if you own the team, your investment is on that field. And if it's not on that field, you're losing money. So, they push you for surgeries. They push to do whatever it takes to get you back on that field. And unfortunately, you look ahead when these guys are older and they're practically crippled from the choices that they made. Thank God we have stem cells today, to help change some of that. I wish I knew about this when I was in college. I would not have done some of the surgeries that I had done, and I'm so happy that you have the opportunity to have this experience it. And, you don't know it now, but 20 years from now, you'll be a very happy man that you did not do the surgery.
Yeah.
How are you healing up right now, since we saw you?
Yeah, so the entire plan, like when we met in Baltimore as well, was we had a date to work towards where they were gonna X-ray my foot to check if the metatarsals were all in line and they weren't kind of splayed out, because the Lisfranc kind of is has a structural role to keep your metatarsals together. So they were gonna do the X-ray, make sure everything was in line, and obviously they were incredibly sorry, I'm blanking out here, but
No, it's okay. I can imagine their faces when they started to see
oh yeah. So,
your
well,
progress. I mean,
I came back from Baltimore, and I just told them like, hey, I got stem cell injection on my foot, and they were pretty sour about it. They didn't like it because I didn't do their treatment, didn't do their surgery, didn't go through them, but they
mhm,
were like reluctantly were like, okay, so we're gonna do an X-ray. I think it was something like a month and a half from then to check if everything is in line. Um so that was the day that we were working towards, and obviously like that time period, like you kind of have your ups and downs mainly mentally, because you can just kind of feel like a little something in your foot and then be suspicious that, oh my
mhm,
God, this isn't working. They're going to be proven right. Um but that day came and we did the X-ray and everything was perfectly in line. The
mhm,
doctor was incredibly impressed.
mhm.
The personal trainers, my coach, they all had a change of tone, because they were really, like you said in your youth, they were really pressuring me and breathing down my neck to just do the surgery.
That's awesome, man. I'm so happy for you, and yeah, it's got to be an eye opener for them. And I wish more people were open minded about this type of treatment. you know but all we can do is stuff like this, share the success stories, put this out there to the world. This is not just for older people, that are getting older and their bodies are slowly degenerating. This is for the young people like yourself. We injure ourselves, and even going back and seeing some of the parents are so competitive. They push the children into sports at a young age, and, sometimes when the kids hurt themselves, they think, well, it's okay. It's just growing pains. He'll be okay. But
Hmm.
these kids hurt themselves, and here now you are at the collegiate level, playing at top level. I mean, it can't be more competitive, so you need every edge possible to stay healthy, to stay ahead of the game. And I really think that everybody that does this stuff really has an edge on the other guys. This makes you stronger, faster, bigger, and the fact when you hurt yourself, you heal tremendously quicker, and that's what we love. And where are you at right now? Are you almost ready? Are you back out on the field? We're still in the process of, we need a little more time.
We need definitely a little more time. I'm about to be out of the boot, and I will say we're playing things safe here, conservative, because it was a severe injury. So I'm definitely going to take my time getting back in the field, because I was in the boot, have been in the boot for over 3 months, so
Hmm.
all the muscles in my calf and my foot are kind of more diminished.
Hmm.
But I'm just about to get out of the boot, and I'm doing some simple strengthening on it, just very light.
Hmm.
And but I think when I get out of the boot, I think I'm gonna be impressed with how fast the turnaround is gonna be, because I can just tell you it feels good.
Hmm.
I don't feel pain in my foot. I walk around in the boot perfectly well.
Well, that was the big question. Like, we know you're coming out of the boot, but obviously when you're around the house and nobody's looking, you might slip out of that boot every now and then.
Yeah.
And I mean, you know how your foot feels. And
Yes,
in your mind, you might be think, wow, this is amazing. I'm ready to go. So in your heart and in your mind, do you feel like this has been a successful journey for you?
absolutely. More
Absolutely.
so than my shoulder, in a
Hmm.
big way, because of the severity of the injury. And just that pressure I had to do the surgery, and then to finally get the approval that, okay, it's working. Whatever you did, it's working, and you're going to be back out in the field much
Yeah.
healthier and much quicker than if I went the route of surgery. because the
Right on.
surgery they were proposing to do was from the date of surgery, it was 6 to 8 months of healing time, and it's obviously much more invasive. And all I got on my foot was a couple of injections, and it's already healed up much
Mhm.
better than any kind of traditional method.
Yeah. And I mean, and that's true. 6 to 8 months, if it all goes well.
Yeah, if it
These
all goes
surgeries,
perfectly. Yep.
I hate to say it, these surgeries have less than a 50% chance of success, often requiring more surgery. And, it's like carpentry. Once you get in there and you start screws and bolts and nuts, and it's not the same. The biomechanics of your body are not the same. I'm so thrilled for you that this has been such a blessing for you. And if there are other athletes out there, teammates, other people around, because people from around the world are going to actually see this video, um, would you recommend this to any other athlete or just a regular person that hurts themselves?
Absolutely, 100% I would. I think that if your injury isn't like completely structural, like a shoulder completely out of place, but you have pain and it's hindering you from playing, I think your first route of action should be investigating stem cells, talking here to Dr. Mark, and he'll be honest with you. Both times he was completely honest with us, and specifically the second time he said, I haven't done this kind of treatment. I'm not 100% sure if it's going to work, but I think it has a really good chance.
Mm-hmm.
And I was willing to take that risk, and I'm so glad I did.
Oh, I'm so happy for you. And it's true. I mean, there are conditions and injuries that we cannot help, and we tell you that. We're never going to mislead a patient, but we'll also help you try to find the right route to go, because the route that sometimes is in front of us is not always the right option. Today, you have to explore all the options out there. You have to question your doctors. You have to get second opinions. When they say doctors are in practice, what that really means is that we're practicing medicine. No one is an expert. Now, luckily, again, and it's been a blessing, I've done so many treatments with great, great doctors all over the world. So we do have a lot of experience with a lot of different things. So that helps. Because of your foot, now I have something else under my belt that I know that we can help people with. And your injury was pretty rare and unique, and hopefully I don't see anything like that again. But if we do, I'm just so glad to know the results. And at some point in this podcast, there'll be a description under the bottom of it. And if you guys don't mind, I wouldn't mind putting maybe some your email or contact information, because listen, you don't have to listen to me. You know, People can call you and ask you personally, hey man, this is not on air anymore. Tell me what really happened. So if it's all right with you, we're gonna put your contact info on there, and if there's somebody that needs guidance, maybe you can help.
100%. I wasn't impressed with it at the moment as it happened, of course, but when we were there the first time and my son had that shoulder injury, you told Andreas specifically, don't train for 4 weeks and then you can start again. That's exactly what he did. 4 weeks passed by almost to the day. He started training again, and it was exactly what you had told him. That means that you know what you're talking about.
That's awesome. I tell you, Hakan, I feel your pain. I couldn't imagine something happening to my son and being, I'm just going to guess, 6,000 miles away, you know, uh,
Yeah,
and not being able to be right there, to help. But the biggest thing that you did do is you guided him to us, so we
yeah,
we can help him with regenerative medicine. And
yes. And I also think about, if this hasn't been done before, with stem cells, it's a pretty severe injury, structural, to a certain point. But if this means that the stem cells can repair this too, oh, it's beyond great.
almost unbelievable, right?
It is almost believable, yeah.
I say it all the time, childbirth is a gift from God, but God didn't stop there. He left that little umbilical cord behind, loaded with brand new stem cells that we can help repair people and give them their quality of life back. So, what a miracle. And again, I'm the fortunate one that I get to see all this stuff. And, you know, most people look at me like I'm some kind of rock star, but that's not the case. We just have a great team together that we get this stuff in you and it goes to work,
Yeah.
and it identifies what's wrong and it assists your body in healing itself. And it's really that simple. And I just really hope from this experience with you, Andreas, the people that are in your college, the doctors, the coaches, the PTs, that they can all look at this as, you know what, this is the route that we should be going moving forward,
Yeah.
and we'll just continue to keep shining your light, so people can see this.
Yeah, I can say for a fact that meeting that I had with them when they reviewed the X-ray and found out that I was healing right and fast, that they had a change of tone big time, and they went from extremely skeptical to interested in what I did and how it works, and just overall impressed with how far I'd come already without surgery.
Right. I tell you what, I wish I was there.
Yeah, I wish
See
you
their
were too.
faces, that would have been a moment, and again, I look at it like this. Even those guys, we're all a team. We should be doing the very best for the patients, not just what is in our own wheelhouse. If I think regenerative medicine isn't enough, well, we'll bring somebody else in that can add on to that, whatever it's going to take, for the patient's success. Because at the end of the day, this is your life. You're a young man. You've got a big life to live, and you don't need this dragging you down for the rest of your life. So I'm happy that I met both of you and your dad, and kind of pushing you in this direction. And although I'd love to see you guys again, I hope it's not on the table in the office. I
Yeah,
hope it's in a more social event, like maybe Hakan will have to plan to go see him play somewhere. You know,
Yeah.
Me and you will
Yeah.
get down on the field, and we'll get our gear on. We'll go show these young guys how to do it.
I'm also happy for this, because uh, once those his team doctors and all those people that you mentioned, his coach and everything, actually, they saw now that this works. It steps up stem cells,
Sure.
Now they know about it. Now they can spread their information. This worked,
Yeah.
and it's actually a great thing, because it pushes stem cells forward,
And I'm always wide open. If any doctors out there are watching this, want to
Yeah.
learn more about regenerative medicine, just
Yes.
reach out to us. Again, there'll be a description in this podcast showing how to get in touch with me. And you could set up a one-on-one time with me, and I would love to help your patients. But not only that, part of my job too is I go around the country training doctors in how to do this. And a long time ago, I figured it out that I can only treat so many people. Me physically, there's only so many hours in a day. So it got to the point where I was like, I have to train other people. That's the only way that this is going to grow, that we can help more people. And when I started doing that, there were some doctors that were, like the doctors where where you go to school, like very well. I don't know about that stuff. It hasn't been proven yet. You know, it's so far beyond being proven. It's not funny. Like you can't stop regenerative medicine anymore. It's in every form of medicine today.
Yeah.
So doctors out there that are looking for help, call me. I'd be more than happy to help answer questions, train you, come to your facility. I've been known to bring a lot of professional athletes to facilities to help launch their programs, and it's been quite a successful journey. And guys like you make it even more successful by sharing your story. And we just continue to wish you, Andreas, the best of success. Of course, we're going to keep following you and seeing how your recovery is. And I can't wait to see that boot come off so you can start getting in the gym again and just tearing it up and let
Yep.
people look at you like, ooh, what'd that boy do? You know?
Yeah, it's right around the corner, and I'm incredibly excited.
Now, when does the season start?
Rugby's typically like a spring semester sport or a winter sport. So over here in the US, the season will run in the spring from February through May, roughly.
Oh, good. So you got some time to really, really
Oh
build
yeah.
this back up.
Yep.
Well, I'm glad the timing is great. And, again, you know how to get me. You know how to reach out to me.
Yeah.
And is there anything that you'd like to share with anybody out there that might be listening to this?
Yeah, I would just say to you that if you face like an injury like I have, just be willing to explore your options, and just realize that things like stem cells specifically, like despite what your doctor may say to you, I advise you to do your own research because there's all the evidence in the world supporting that it is truly regenerative and truly works.
That's awesome. I appreciate that. Hakan, any closing thoughts from Dad in Sweden?
No, it's just the same thing, it's just you just have to do your own research, and believe in what you hear, you really got to believe what you hear too, I mean, it's proven and it works,
How are
and
you guys doing over there?
we're doing really good, thank you.
Did you set your world record yet?
No, but I'm working on it. I got a couple of minor injuries, but I'm coming around them now, and I'm working on it. And
Do I need to come out to Sweden?
yeah, you do. You need to come cheer me on.
All right. Listen, get your private Learjet, send him over to pick me up, and I'll be over there, this weekend. Well, we're good.
Yes, I'm just so very thankful, Dr. Mark, for treating me, but mainly treating my son through those two injuries, and my fiance. Different kind of stuff, but they all work. They all work very well.
It's great news.
Yeah.
I appreciate the thanks, and I appreciate the trust. When you send a family member to me, it means a great deal to me, and I do not take that lightly. And I try to treat everybody as if they're my own.
You always answer me right away, doesn't matter what day of the week it is, and it just creates a lot of trust and a lot of bond.
Hakan, you're 6 hours ahead of us, right?
Of you, yes, yeah.
So right now it's 3:30 here. It's 9:30 there.
Yes, yes.
So I appreciate you thanking me for always picking up the phone, but please stop calling me at 3, 4 in the morning. I know that's the morning for you, but
Yes.
some of us are still sleeping over here, in the United States.
I'll try to think of that, Dr. Mark.
I'll be laying in bed and all of a sudden I hear the phone ring and all of a sudden it's like, oh my goodness, who is it? Oh, it's Hakan. Let me grab that real quick.
It's the darn sweet again.
It's a Swede. Well, listen, guys, it has been an absolute pleasure having you on. I can't wait for this to get out so people can hear it, see it, and if there's anybody out there that we can help with something similar, or if you just have questions, just reach out. We'd love to connect. And you guys, we're going to stay in touch. Andreas, call me anytime. You know that.
Thank you, Dr. Mark.
Yes.
Yeah.
I really
Let me
mean
say as well that I think I speak for the both of us, me and my dad here, that we're both incredibly grateful for what you do. Just having this service available to you and just finding you in the right time, it's just been, like you say, it's been like a miracle.
Oh, thank you. Thank you. It's my pleasure.